Mrs. Smith is a 69-year-old patient attending your clinic today, complaining of a wobbly lower right back tooth associated with a swelling. Medical chart reveals that the patient has a history of myocardial infarction, hypothyroidism, and osteoporosis. She is taking atenolol, verapamil, warfarin, thyroxine, and calcium for this medical conditions. She is also taking denosumab injections intramuscularly. Her last injection was 2 days ago. On examination, you find that 4/6 is whitened and has a grade 3 mobility and an abscess around it. She has been taking Panadine 4 for pain relief, but it has not been very effective. Address the patient's concerns, give your diagnosis and management.
Here, the pointers are the importance of a complex medical history like this, and denosumab, which also has complications. We must explain the complications and the impact that it would have on the dental treatment. The referral process, because of this complex medical history, we must discuss the referral process for this case and the immediate management for this case, about what are we doing today in our practice, and also warning the patient about emergency management in case she does have complications after we have treated her in the practice today. Let's dive into the role play now. Hi, Mrs. Smith. How are you feeling?
Hi, I'm okay, better.
So I'll sit you up and we will just discuss about what we've seen. Are you okay?
Yeah, the tooth is quite troubling.
Yeah, I can imagine. Are you in any sort of pain at the moment?
It's not pain, but it's, very uncomfortable when, when one small part of something is moving inside your mouth. It's not very nice.
Yeah, that's right. Yes, I can see, and it does look quite uncomfortable. Even when I was having a look at it, I could tell that. Now, I do have a few questions about do you smoke?
Oh, yes, I do.
Yeah.
I do smoke about, depends on my stress level. I sometimes smoke up to a pack a day.
Okay, right. And you've been smoking for a while?
Quite a while. Yeah.
Okay, that's okay. We will discuss about this towards the end of the appointment as well, why it's important to think about cutting down on smoking. So what you have right now is called as a periodontal abscess. So what it means is that the teeth have lost support from the surrounding bone and the tissues. So the plaque, the bacteria, they have all gone down the tissues and between the gap between the teeth and the gums. So that has now led to the bacteria causing infection at the bottom of those teeth. So that has also caused a little bit of loosening of the teeth there as well. So now we do really need to address this problem.
Is this something serious?
It's not serious as such, but it definitely needs our attention, immediate management, because this can just complicate further and lead to more problems within the body. So we don't want this infection spreading around.
Okay.
So
can you just remove my teeth then?
Yes, that needs to be done, but we do have to consider a few factors. From your medical history, I can actually see that you are taking a lot of medications.
Yeah.
Right? Yeah. So I know, but you've still got most of your teeth, so that that in itself is a good thing, right? We will definitely endeavor to make sure that you have a good care and a better quality of these teeth in future. So coming back to your medical history, there are particularly two medications that I am concerned about of all the ones that you're taking. So the warfarin that you're in right now, it is a good medication. Obviously, it helps you to control your the blood thinning ability and all of it. But the problem with it is when we take teeth out, this can actually cause increased bleeding. So it needs to be addressed with care. So we do need to consult with your GP, the management, if there's a situation where the tooth needs to come out. But of particular importance is denosumab, the other one that you're taking right now. It does say here on your notes that you've just had your last shot 2 days ago. Is that right?
Yes, I just had my shot 2 days ago. Yes.
Right. And how long have you been on denosumab for?
So I think I've taken denosumab for I think 3 years now. I've taken 2 shots a year.
All right. Okay. So that's fairly long term. So with denosumab, it's a great medication for osteoporosis. It really helps with the bone turnover. It does help with your condition. But in dentistry, it has a very important role. It does not encourage good bone healing once a tooth comes off. And that's the reason why we are extra cautious when somebody is on denosumab.
Oh, okay. So am I in danger?
So it's the condition that denosumab can cause. It's not definitive. It does not happen in everyone. This is called as a medication-related osteoradionecrosis of the jaw. It is just a fancy term to say that the bone will not heal on time. So when that happens, it becomes really hard for us to manage in a general dental setup. So then we do need to send you to a specialist.
Is it very painful?
It does get painful. It can get infectious as well at some point.
Okay.
But the most annoying bit is that you will have exposed bone, which just does not heal after the tooth comes off. And this is the risk that we shouldn't be taking in a general practice. My recommendation at this point would be that it's best to refer you to see a specialist who would be able to handle this condition better.
Okay. And do I get to see him quickly?
I will definitely put in an urgent request to say that you should be seen as early as possible. But in the interim, we will do some local management today. So I'll just clean around the tooth. I'll drain the pus out with my fingers, and I'll also just apply a lot of pressure and also use a little bit of saline.
Okay.
And I'll just flush out that area around there. Hopefully that relieves the pressure on the teeth around that area. And once that's done, we'll give you some antibiotics today. Are you allergic to any antibiotics at all?
No, I don't think I am.
Okay, that's good. So we'll prescribe Augmentin Duoforte today. So that's 2 tablets for 5 days.
Okay.
And then that should also control the infection. You are welcome to take any pain relief that you'd like, but I know that you had taken Panadine Forte and you said it wasn't really working that much. You can take Panadol and Nurofen together. That can also still work for you.
Okay, sure.
But hopefully the antibiotics will also help control the infection there. In any case, if after doing all this you still experience severe fever, swelling, difficulty breathing, difficulty swallowing, you must see the emergency department immediately.
Okay. Yeah, sure.
Yeah. And the other thing that I wanted to discuss with you is we do need to see you back in the surgery at some point for regular recall and maintenance, because it does look like you have advanced gum disease, and I just need to see all your other teeth as well. And we also need to make sure that this does not happen again.
Yeah, it's quite painful. I wouldn't want another episode.
Yeah, absolutely. Yeah. So I think we should definitely schedule that as well going forward. And the last thing I would encourage is try and cut back on your smoking. I know it's hard. I know it's easier said than done, and it does take a few tries, but smoking does have a direct impact on our gum health. It does reduce blood supply to our oral tissues, our gums. So in a way, it masks the dental disease itself. So if you are able to cut down on smoking, that's something that that would help your condition as well.
I'll think about that. Yes.
Yeah. I'm happy to provide some resources as well for you.
Yes, please.
That can also help you with, considering what your options are.
Okay.
Are there any other questions for me, Mrs. Smith?
You think that the mobility will stop once you, like you said, you'd press and remove the pus? Will it help me feel better till I see the specialist?
We will definitely do our best to make this a comfortable experience, but it is hard to say whether the tooth will regain its previous strength or not, because it is damaged quite to an extent. Especially the bone around it is not strong enough, but hopefully the antibiotics should also reduce the discomfort that you have.
Okay.
Yeah.
Okay. Thank you so much.
All right.